Hello, everyone, and welcome back. I'm so excited you are here. We recently taught a masterclass on how to become more fluent in concussion rehabilitation because truly, concussion is its own language, especially when you're looking at the scope of what all of our different professions can cover. And I always say on this, we taught a masterclass. And what I loved about it is because I always talk about concussion clinicians. And I talk about concussion clinicians because I'm a physical therapist, but I work with chiropractors and RMTs and OTs and acupuncturists, and I mentor clinicians in all of this space. And when you looked at who enrolled in that masterclass that we just had, it was amazing because that's what happened, right? We had PTs, OTs, ATs, massage therapists, chiropractors, we had physicians, we had psychologists, we had counselors, we had coaches all enroll in this masterclass to help them become more fluent in integrative concussion rehabilitation. And it's why I say concussion clinician, because it doesn't just have to be one profession. And the beautiful thing is that when we have this multidisciplinary community of people who share a passion, it's what lets us start to see things through a different lens, right? It's what allows us to go deeper and learn new skills. And it what allows us to also build our own referral network as well to support our clients. So it was a blast on this masterclass. One of the multiple things we talked about was how you can actually use the phenotypes, right? So one of our first couple episodes we talk about on this podcast is the different phenotypes of concussion. And we talk about how you can use those phenotypes as an assessment framework. And this was a huge hit. So I wanted to bring this to the podcast. And if you're listening to this and you want to see the slide deck or you want to see what else was in this masterclass, just send me a message and I'll send you the replay so that you can have access to it. But you truly can use the phenotypes as a framework for assessment. And the reason I say this is because we obviously have indicators when someone comes in with an acute concussion that can predict potentially if someone is going to become more persistent in the symptomology space. Okay. So we talked about that on the masterclass too. But one of the key things that comes up in the research over and over and over again is that someone should be connecting with a provider within the first 7 days, or it will potentially prolong their recovery. But here's the thing is that there are 7 different phenotypes of concussion, 7 different symptom profiles or subprofiles of concussion. It doesn't just affect one thing. And so our job as concussion clinicians is that when someone comes in with an acute concussion or any form of concussion, we need to be at minimum screening for the 7 different phenotypes. So what do I mean by this? I've had stories of individuals that come into the clinic or they'll message me on Instagram and be like, I went to a concussion clinic and they did an exercise test and I was totally fine. And so they told me I didn't have a concussion. Well, that exercise test is one test in one phenotype. It's not enough, right? Or you'll have other individuals that come in and say, they tested this thing with my eyes. I think they called it a VOMS. And the eye was good. So they said I didn't have a concussion. Well, the VOMS simply screens vestibular and ocular. That's 2 of the 7 phenotypes. So if we as clinicians are not screening for the 7 different phenotypes of concussion, then we could potentially be missing something that's going to slow our client's recovery. I know we all do our best, but when we know better, we do better, right? So now this doesn't mean that obviously when we treat in silo. Treatment becomes more integrative, but this is a really great way to take your assessment and break it down to screen for all the areas. So this was the homework I gave people on the masterclass that was loved. So what I said is I want you to take just a regular piece of paper, right? And I demonstrated this on the slide deck. And I said, we're going to break this piece of paper into the 7 phenotypes. So you have your physiologic, your vestibular, your visual/ocular motor, your cervical, your cognitive, your affective, and then although it's not a phenotype, we also assess somatosensory. And I want you to break it into these different squares on this piece of paper. I said, then I want you to go to what you currently use for your assessment, both from your acute assessment, and then I want you to go and do 2 sheets of paper. One's for your acute assessment and one's for your persistent assessment. And I want you to take that acute assessment and I want you to take all the tests you do and I want you to break it into the phenotype that that test is screening for. So, for example, if you're doing a Buffalo concussion treadmill test or some sort of exercise test, you're screening physiologic. Okay. If you're looking at heart rate variability pre and post, you're screening physiologic. If you're using the VOMS, okay, there's an element to the VOMS that's screening vestibular, there's an element of the VOMS that's screening visual, right? If you're doing range of motion and joint position sense, you're screening cervical. If you're doing a GAD-7 or a PHQ-9 and taking a solid history, you're screening for affective. If you're testing different reaction times or processing time tests, you're screening cognitive, right? So I want you to take the tests you're already doing and just put them into the phenotype that you're screening for. And then I want you to take a step back and I want you to look at that piece of paper. And I want you to ask yourself if you truly believe you're screening for all the phenotypes enough. Or is there a phenotype that you're like, oh, I need to do some more stuff here? I will say what came through the masterclass is while people are pretty darn good at screening at vestibular and visual and cervical, there's usually a big gap in how you effectively screen for physiologic/autonomic and affective. And we need to screen those areas because what I will say is individuals that come in with persistent symptoms, the nervous system and the physiologic component is almost always part of the equation. The autonomic nervous system is the fundamental piece of everything we do, right? When you look at a study from Letty, and I think I shared this in the earlier podcast too, it was a team of adolescent boys, and they found that 70% of them had physiologic phenotypes based on a tilt table test, based on blood pressure changes from lying to standing, right? So I encourage you from a screening perspective of an acute concussion, take your acute assessment, plug it into the phenotypes on this grid, and step back to be like, am I screening them appropriately? Now, step 2 is actually to look at from the persistent concussion side. Because if our client has shifted from acute into persistent, then a screen is not enough, right? If our client has shifted from acute to persistent, just doing the VOMS is not enough. Just doing range of motion is not enough. Just doing an exercise test is not enough. So then I would say, and that question for you is it's a bit of a framework and a mindset shift of if my client has gone from acute to persistent, now when I look at the phenotypes, because again, there's an interactive nature, concussion can have diffuse effects, and the research shows us that multiple phenotypes are typically involved and that we need to ensure we're addressing them. So what does your persistent assessment look like? Take that assessment that you're already using in your clinic, break it down into the phenotypes in detail, list everything you're doing in that phenotype, and then step back and be like, okay, here's where I'm doing really well. Here's where I could be doing better. Here's where I think I'm getting a bit of information, but I wish I could get more. Or my assessment is the exact same. What am I missing? Especially if you're staying on that screen spot. So this is going to be like a super short and sweet and quick podcast episode because this was an exercise that actually came out of the masterclass that people loved. It gave them a new way to step away from to look at phenotypes in a constructive way for them to be able to actually take that back to their practice. We also talk about how the phenotypes are a really great way to be able to explain to your client what they are feeling, right? So for our clients, a lot of the time they have all these symptoms that fall into phenotypes, but for the client, they feel unrelated and feel like they're scattered all over the place. For you to be able to go through an assessment and then be able to say, I need you to know what you're experiencing is normal. We have this thing called phenotypes in the concussion space, and there's 7 different types. The brain is affected in multiple ways after a concussion. The symptoms that you're experiencing And that, with the assessment, we said, show me that you're actually currently demonstrating 3 of these different phenotypes, right? When you look at some of the research, the vestibular ocular phenotype in one study of over, I think it was 200 or 300 people, makes up more than 1/3 of the phenotypes exhibited in clinic, right? If you're looking at individual phenotypes, affective is quite high and migraine is quite high, right? So to be able to then take all this data that you collect and then be able to sit with your client and be like, this is what this means. I need you to know this is normal. It's common to have more than one phenotype because when we think about things, right? So now when we look at things, nothing works in silo. So of course there's an interactive nature between the phenotypes and people might be experiencing more than one. So this was just a little homework for you, a different way to think about phenotypes in a way that you can actually take this back to your clinic to do some self-assessment and just some self-awareness and thinking for yourself. I said yourself there a lot. But this was definitely a highlight from the masterclass. If you would like the recording of the masterclass, we also went deeper into those predictive things that happen that you can see in the acute stage that should raise those yellow flags for you on why someone might develop persistent sessions. We went into the phenotypes more. We talked about how you begin to do treatment and structures treatment plans to get the most from them. And we talked about the power of rapport and how that lays into building how much you can challenge your client. And that was another great part too. So I'll probably do an episode on that. But if you would like that replay to that masterclass, please just send me a message on Instagram at natasha.wilch. Would love to connect with you. And I hope that you found this helpful. Wishing you an amazing day, my friends. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.